It is no surprise that drug or alcohol use can have some troubling consequences. If your loved one is abusing drugs or alcohol, make no mistake, it is affecting their health in a negative way. No matter what it is, if continued to be ingested in large amounts and on a daily basis, it can lead to long-term health problems. Signs of the damage don't even show up until it's too late. Alcohol attacks the liver more than any other organ in the body. After all, it's the liver that has to process the alcohol. When years of alcohol abuse have damaged the liver beyond repair, cirrhosis is often the result. Other long-term effects of alcohol include nerve damage, high blood pressure, heart disease, and brain damage. Eventually, people who abuse alcohol over long periods of time can also experience vitamin B1 deficiencies. The only way for a person to get their health back and undo some of the damage is to get into treatment, abstain from alcohol, and start eating a healthy and balanced diet. Just because alcohol is legal doesn't take away from the fact that it does cause severe health problems long term, not to mention injuries sustained from falling, a crashing car, or perhaps even drowning. Excessive alcohol use is also more likely to cause an individual to act out in anger, resulting in domestic violence and firearm injuries. For those who have used alcohol for long periods of time and become physically dependent, withdrawal and detox without proper help can be fatal. Reaching out and getting help is the best course of action to take. Our country is now experiencing a massive opioid epidemic that is claiming the lives of tens of thousands of people a year. Opioids have proven to be hazardous to both short-term and long-term health, but the longer that opioids are used, the more an individual's health is affected. For example, opioids drastically change the way that a person copes with stress and pain. Opioids can reduce the body's natural pain and stress-fighting ability. Tolerance is also an issue because it builds quickly. The more an individual uses opioids, the higher the tolerance, and as a result, the individual must take higher doses just to feel normal. They become dependent as well and experience intense withdrawal when they stop taking them. It is also well known that if a physician discontinues a prescription due to signs of addiction, or if prescription opioids become too costly, the more likely they are eventually to try heroin, which is a cheaper alternative, although illegal. If an individual begins using heroin and falls into the trap of intravenous drug use, they can experience a large amount of complications as a result, including but not limited to infections in the bloodstream and heart, contraction of hepatitis C or HIV, abscesses, cotton fever, and more. When IV use comes into the picture, things get dangerous. If someone you love is addicted to opioids or heroin, it is imperative that you intervene on their situation before it's too late. The next drug we are going to talk about is something that is commonly prescribed by physicians to treat anxiety disorders. Benzodiazepines are dangerous when abused long term, especially if used in conjunction with other drugs or alcohol. One of the biggest dangers of benzodiazepines are the damage that it does to individuals' cognitive abilities. It's no surprise and should never be a question if benzodiazepines cause brain damage, because the answer is yes, they absolutely do. On top of brain damage, an individual can quickly find themselves dependent on benzodiazepines to the point where they can experience seizures if they try to stop. There have been numerous cases where men and women have died as a result of benzodiazepine withdrawal. The body becomes so dependent on the benzodiazepines that it quite literally results in seizures, and an individual's entire system can shut down. If you have a loved one who is currently addicted to benzodiazepines, it is very important that they don't attempt to detox on their own. These people need a professional intervention and medical supervision to handle detox and withdrawal symptoms. Methamphetamine is a very dangerous drug. The long-term effects of this drug are perhaps the most physically damaging. Methamphetamine is also highly addictive, and users tend to physically and mentally deteriorate at a faster pace than other drugs. The long-term effects of methamphetamine are changes in brain structure and brain function, problems in thinking and fine motor skills, decreased ability to concentrate, where users experience hallucinations and even perceive events that are not occurring. Meth acts as a neurotoxin on the body and can cause severe mood disturbances as well. Longtime meth users usually end up with destroyed and damaged teeth, known as meth mouth. The good news is when an individual enters into recovery, it's possible that many of these effects will diminish and the brain will eventually restore itself. It is so important to intervene on their drug use and help get them into treatment. It is a helpless feeling to watch your loved one slowly be taken over by drugs or alcohol. Your loved one needs help. If you would like more information on the life-saving tool of intervention, one of our intervention specialists can assess your case and help you set up an intervention that could very well save their life. Thank you for watching.
Please feel free to comment, like, or subscribe to our channel.